Today we will be presenting a panel on COVID-19 and waste management. We are very excited for this topic and glad to have such a great panelist joining us today. Thank you very much, everyone, agreeing to join. In such busy times, I know all of you are really busy with issues at the moment, so thank you. What we really wanted to do is actually talk about certain issues and concerns surrounding waste collectors, waste pickers, informal sector, and not so well-equipped waste management systems during this pandemic, which is the reality of many countries, sadly. So through the panel of experts, we will be unpacking key challenges and unfolding certain regulations and measurements to tackle issues at hand. So apparently we got a full house today, I believe. So we would be going to crack on because 1 hour or so is never really enough when you have get informed people willing to share their experiences and insights. So before we start off, a little bit of housekeeping from my side. We will start off with brief self-introduction of the panelist and ISWA Young Professional Group, followed by short presentations by each panelist. And in the end, we will have a good enough time of like 20 to 30 minutes for a good discussion. So my job is quite simple. It's to keep the key to time and to keep the questions rolling. So make sure you send your questions to us using the chat. So you can send in your questions in text, and I'll be scanning and keeping track of the question for you guys and making sure that we can provoke some good discussion. Last but the least, I would request if everybody can mute themselves except the speakers, just to cancel the background noise. Yeah, if we have done that, Rachel, could you please introduce yourself and the ISWA YPG itself, that what we are and what we do, before I start off with my panel?
All right, thanks, Shiza. So hi, everyone. Good morning, good evening, and yeah, good day. I just want to thank Shiza and Nina for organizing this webinar. It's a very interesting topic right now, especially with what's happening all around the world. And I'd like to thank everyone for joining today. I'm Ray, or Rachel, from Malaysia, and I work in the Waste Management Association of Malaysia. And this year I am the chair of the ISWA YPG until end of the year. So I'll just keep this really short and just brief you guys about the ISWA YPG. So we've been around since 2013 and are united by our common passion for sustainable production, consumption, and disposal practices. So our group, we have about 144 members from 52 different countries, which is a great network. And so whoever is in the age between below 35, you guys can join us. And as long as you're an ISWA member, please do join us in our network. And if you are working or studying in the field of waste and resource management, yeah, feel free to join us. So I'll just let you guys know that we have 7 very active YPG working groups, which consist of the local and regional networks. This is the network, regional networks that start off different YPG groups in different countries, whereby we have more engagement and more members that can meet each other in their respective countries. And then we have our online discussion meetings, which is the one that we're doing today. This is led by Nina and Shiza. And then we have a marketing and communication working group as well, a mentorship and career development working group, education working group, research and innovation working group, as well as the ISWA World Congress working group. So if any of you who are an ISWA member and is already part of the ISWA YPG, please do feel free to join us, and you can just write into Nina, Shiza, or myself, or you can write into our general email, which is ypg@iswa.org, or check out our website or Facebook group. Yeah, and so if you're interested, just feel free to join us. And another thing we have to highlight is that we have annual flagship projects, which will be launched really soon. So this year's target is mainly to highlight people in the waste industry and to show appreciation to people in the waste industry. Aside from that, we also have our annual online conference, which would be happening in July. And then our mentorship program is already started. So maybe if you guys are interested, you could join next year's mentorship program. And we have also special sessions during the World Congress in ISWA. So yeah, that's all from my side. If you have any questions, do feel free to drop us a line. Thank you.
Thank you, Roy. And we will be providing you with the links where you can provide the feedback and everything. So moving back to the panelists, I will be asking each panelist at a time to introduce themselves and a bit of their work. So perhaps starting with Pablo, could you please introduce yourself and a bit about your research and your work? Yeah.
Yes, so I am Pablo Navarrete, assistant professor at Universidad de Chile, researcher at Politecnico di Milano, and visiting fellow at the Latin American Center at the London School of Economics. My research is mainly about support policies to the informal economy in three sectors. One of them is waste pickers. And basically what I have analyzed and what I'm interested on is policies for supporting the sustainability, that means the economic, social, and environmental performance of waste pickers. Yeah, so that's it.
Thank you. Sonia, could you be the next person to introduce yourself and your work at WIEGO? WIEGO, sorry. Yeah.
Well, WIEGO, yes, thank you.
Oh, okay.
It's a pleasure to be here. Thank you very much for the invitation. I'm Sonia Dias. I am a garbologist. I've been working since 1985 in solid waste, mainly working the interface of technical and social issues in this area. And I was a city officer at Belo Horizonte City Sanitation Department and have worked for many organizations, research and consulting organizations. I am an engaged scholar, which means that I'm a researcher / activist, and I am WIEGO's waste specialist. WIEGO is a research action and policy advocacy network that works with and for informal workers, such as street vendors, home-based workers, and also informal waste pickers. This is me. Thank you.
Yeah. Thank you, Sonia. Thank you so much. Zoe, could you perhaps do the same and introduce yourself and your work at WasteAid? Yeah.
Hi, thanks very much. Nice to see you all here. Yeah, so my name is Zoë Lenkiewicz. I am Head of Programs and Engagement at WasteAid. WasteAid is a UK-based NGO, and we work across many countries in lower income areas. We campaign to raise the profile of waste management. We actively train community groups in how to better manage their waste where there's no municipal service. And we also produce educational materials for communities that don't have waste management service so that they can better manage it themselves.
Thank you, Zoe. Thank you so much. Next, Anna, could you please introduce yourself and your work at WIEGO? Yeah.
Sure. Thank you. Good morning and good afternoon and good evening to everyone. It's a real pleasure to be here with all the panelists, and I thank you once again for the invitation. I'm a research associate for WIEGO's Urban Policies program, and I'm currently based in Belo Horizonte, Brazil with Sonia. And I've been working for the past 9 years with informal workers, more specifically waste pickers here in Belo Horizonte and other cities in Brazil and also in the world. And I've specifically worked on the informal economy monitoring study study, the Gender and Waste Project, and the QUIDAR project, which we'll be speaking about today as well. And my interests are really in the area of gender, participatory governance, participatory methodologies, and social justice and movements. So hope to share some of our insights from the ground with you all today.
Yeah, thank you. Could you please confirm if Samuel has joined so he could introduce himself as well?
Yes, he has joined.
Okay.
Yeah,
sorry,
hello,
I can't hear
my
your
name
name,
is
but yeah. Could you please introduce yourself
yeah.
and your work as with the waste picker community? Yeah.
Yeah, hello to all. Thanks for the invitation. I like to present me as a friend of Sonia Dias first, if you agree, but also as Samuel, member, founder of Waste Pickers Association in the region near Paris, in France. So we are 500 members who pick up the waste and sell in second-hand market, informal second-hand market, and sell also to the industry all the metal we can pick up. So I'm very pleased to be here, and our informal workers are all in very big difficulties during the lockdown in France since 1 month, and it will continue during 1 month. So we now have stopped all activities of collect and sales and organized market, and we only focus on how to provide food to our members. There is a kind of alimentary and sanitarian crisis in our suburbs of Paris, so that's what we are doing since 1 month, and we continue to collect tons of food. So we are, in general, we are looking for the recognition, the recognition of our contribution to reducing waste and to reuse and recycle. We are part of the Global Alliance of Waste Pickers, and I have the honor sometimes to be very near WIEGO. So that's it.
Thank you, Samuel. I'll get back to you. We have quite a few questions for you because we would love to have your insights and waste picker insights. And thank you, Sonia, for suggesting that. Sonia, we can start off with your presentation. And Nina, perhaps if you can share Sonia's presentation while she would be presenting.
Okay. Okay, she's going to, okay. Okay, thank you. So once again, good morning to all, or good afternoon, or good evening, depending where you are. It is a pleasure to be here to join this important webinar and to contribute with reflections from WIEGO's perspective. Can I have the next slide, please? Well, let us begin by first just reviewing who the waste pickers, informal waste pickers are across the globe. So informal waste pickers, those who may collect or sort and or process household or commercial and sometimes industrial waste, either on the streets or in sorting centers or in open dumps. And according to the ILO Green Jobs report, there are 20 million people working in this sector. We know that the waste pickers provide essential services in cities' recycling systems, even if they are not recognized as, as essential service providers. And in some contexts, they also offer the only household waste collection that there is. Next slide, please. So this current outbreak poses many unique challenges to the waste sector in general. We know that the formal solid waste industry in many developed and developing countries are already calling for an immediate reassessment of their coronavirus solid waste management guidelines. It has been a crisis that shows that to some extent, even the most prepared solid waste systems are, in a way, unprepared in terms of responding to the crisis. We have heard news of sanitation garages being shut down, and we are hearing about formal workers calling for protection. So even the best funded and well-organized formal systems are struggling to cope with this pandemic. The next slide, please. So, this current outbreak poses many unique challenges, as I was speaking, to the waste sector in general, but it also poses very important challenges and expose informal waste pickers to greater risk. There is this greater vulnerability of informal waste workers because of their exposure to insalubrious environments, be it in open dumps or even in sorting centers, because most often they lack access to safety equipment such as gloves and masks. They work in environments with not enough ventilation and overcrowded spaces. And with this current outbreak, there is an increase of medical waste from homes and offices. And as we all know, there are a number of studies beginning to show that the lifespan of the virus on inanimate surfaces is much greater than in other coronavirus. So there are serious implications for the health of informal waste pickers. And this means that coronavirus brings an additional layer of vulnerability that we cannot minimize. And in addition to these health challenges, workers are also facing threats in terms of losing their niches to big private actors, and in some countries and cities, the shutting down of middleman depots. So all of that adds, layers of vulnerabilities and brings challenges for informal waste pickers. Can I have the next slide, please? So this means that we need to take important measures to protect these workers, and precautionary measures to address health and livelihoods are really, really important. Safety measures and also cash grants so that workers can comply with lockdowns. And we need to make it clear that without government support, informal waste pickers cannot follow public authorities' guidelines, because these workers, as we know, are already dispossessed in so many ways, which means that the current lockdowns measures aggravate their dispossession even further. This means that we need a more... Hello?
Everyone, could you please mute your
background noise? Yes. Can I have the next slide, please? I can't see the slide.
Yeah, she was trying to mute the audience.
Okay.
Yeah.
Okay, thank you. Thank you very much. So as I was saying, all of this means that we do need a more holistic approach, an approach that integrates sanitary, economic, and social protection measures to address informal waste speakers' particular needs with this pandemic. Can I have the next slide, please? The next slide. So it was in line with this understanding that we need a more holistic approach, understanding the interconnections of all the vulnerabilities that waste speakers are exposed to, that WIEGO's Cuidar Health Waste project spearheaded a process to draft some guidelines. We gathered some experts such as epidemiologists and labor experts from the University of Brasilia. Brasilia is the capital city of Brazil. And from the Health Foundation, FUNED, and also specialists from the working group that we belong to, the Waste Workers Occupational Safety and Health Working Group. And together, we drafted some guidelines for waste speakers' personal health and also guidelines for them to operate their work areas. And these guidelines, first and foremost, call for alliances to support waste speakers to fight, to struggle for the basic conditions that they need in terms of safety and also in terms of access to cash grants, so that the losses, their livelihood losses, can be compensated. And we know that waste speakers across the world have been leading in terms of drafting guidelines and also launching some campaigns for fundraising, for hygiene equipment, and for cash grants. And there is a wealth of information that can be found in the Global REC website, the Global REC being the Global Alliance of Waste Speakers. And these resources have an array of options that waste speakers from around the world can draw from. Safety resources, also the initiatives that are being run, like community kitchen initiatives. The next slide, please. Here we can see one of our posters. We have many materials and resources in the WIEGO website and also in the Global Alliance Waste Speakers website. And just a quick overview of this poster. One important thing is that we're calling people to always respect the local public health and lockdown orders, and to struggle with their allies to enable waste speakers to have access to cash grants and safety equipment. The next slide, please. So, what can governments do in terms of mitigating this current phase of coronavirus outbreak? Government should provide the conditions that enable workers to practice social distance and to adopt the hygiene measures that are being prescribed. And one fundamental and urgent action is cash grant, which needs to be disbursed in ways that it makes it easy for workers to have access to them. We also need governments to provide safety information on coronavirus so that waste pickers have enough knowledge to protect themselves. And we also need governments to support waste pickers to have access to hand sanitizers, to waste stations, to masks and soaps. And waste pickers should be entitled to coronavirus testing and treatment. In many contexts, informal waste pickers, they provide the only domestic waste collection that there is, and they are risking their lives to protect public health. And they should be acknowledged as essential service providers and granted access to proper protection and be paid for the services. The next slide, please. So looking ahead in terms of post-COVID-19 crisis, we do need to invest more on building informal workers' capacity to deliver in complementarity with formal systems. And we need to strengthen their capacity to withstand or recover from all sorts of impacts, health impacts, economic, climate change. So here, the notion of resilience, which has been traditionally more associated with climate change, it is a useful notion in this current outbreak, because there is an interconnection between health, economic, and environmental crisis that we do need to explore a bit more. And in this sense, we need a total reshape of solid waste systems so that it can take into consideration that informal workers are part and parcel of the economy, and they feed the recycling markets with the raw materials that sustain production, that takes into consideration that waste pickers are contributors to public health and are environmental stewards. We still need to deepen our understanding of the necessary conditions that can enable these workers to be granted the role of essential service providers. The next slide, please. So we need to really start digging into this concept of essential service providers. And we need to ask ourselves, what are the necessary changes that workers will have to introduce in their work routine? What are the roles of governments and the role of the industry in terms of securing the decent work conditions and also securing fairness in a value chain that is so unfair to informal workers? Next slide, please. And more than ever, we need to build a strategic alliance between waste pickers organizations and the sanitation sector, those in the sanitation sector that are committed to delivering well-managed solid waste systems, but within models that include the working poor. And we need to work hard to build capacity for informal workers' organizations to embrace safety as part of their work so that they can be better protected and demonstrate that they can be reliable service providers and that they can be compliant to public health standards. We need governments at all levels to understand and commit to an inclusive solid waste system. We need a complete redesign of the value chain towards fairness. And we are all in this together, and this calls for a coordinated effort across countries, across organizations, across sectors. I think we do need a new social contract. Thank you very much.
Thank you, Sonia. You did actually raise quite interesting and important points, which I'll get back to you in our Q&A session. A quick reminder to everyone that you guys can comment your question in the chat box. For the next, Pablo, I would request you to present your presentation. Nina, if you could share Pablo's presentation.
Wait a minute, I'm just trying to mute
Sure.
those people who may produce the noise.
Yep.
Okay.
Okay.
Can you hear me well?
Yeah, we can hear you well. Yeah.
Okay, good.
Nina, I think it's good enough. You can share the presentation now. Yeah.
Okay. First of all, thank you for the invitation. I think it's a really interesting panel with people that have been quite influential in the topic. And it's nice as well to have people working, having waste speakers giving their opinion as well. So what I'm going to concentrate is, so my presentation is called Supporting Waste Speakers in the COVID Pandemic Crisis, and it's mainly about trying to understand why I think developing countries is going to be particularly exposed to COVID-19, and waste speakers, they have even a larger probability of being exposed to this disease. So next slide. So the structure of the presentation is going to be in 4 parts. In the first part, I'm going to try to get a few facts about the current situation of COVID-19 and the difference between developed and developing countries' reaction capacity. Then what I think is the particular risk of waste speakers, and then some potential policy measures at the government level, community level, and self-protection to finally end with the conclusion. Next, please. Next. Yeah, great. So worldwide, there are 1.8 million cases, and the death toll is 114,000. According to the European Center for Disease and Prevention Control, 32% of COVID patients need hospitalization, 11% of them die, and that gives a 1.5% mortality rate of reported cases. Next. But as you can see in this map, so this map basically darker color shows where higher concentration of COVID cases now is really much a developed country disease, but is rapidly expanding to the developing world. So all the news is about, for instance, France, Spain, UK, the US, but these are countries that have a very high capacity to react to this health crisis compared with developing countries. Next. So this is a graph that pretty much everyone is familiar with, and it's showing the main problem of this disease. So it's highly contagious, and the problem in Europe was they took very long to actually make the lockdown, and therefore there was a widespread of the COVID-19, and that exceeded the capacity of the healthcare system. So at the top of the regular kills that would make COVID-19, you have more people dying because they don't get the right health care for recovering. And so what they did is it's a total lockdown. I am currently in Paris and close in my house, and that is a measure for actually flattening the infection rate. So actually, the health system can cope with the demand. Next slide. So now, even all these measures, the report of the 8 April 2020 of the European Union says that the risk of health and social system being exceeded is high in this mitigation, with this mitigation measure, and very high with insufficient measure. And currently in the EU, there is a shortage of testing capacity, protective, personal protective equipment, and health care capacity. Next. So the point I'm trying to make is, if that is what is happening in Europe, that have a large social protection system, we should expect a much worse scenario for developing countries. So, for instance, one of the most famous cases is the case of Italy, that the health system was totally overpassed. And one key indicator of the health capacity is hospitalization beds for 1,000 inhabitants. So in the case of Italy, you have 3.4 beds per 1,000 inhabitants. But when you compare with India, India is 0.6. So basically, Italy 10 times have a health system that is 10 times larger per capita than India. So when the disease arrives to India, that's going to be a really, really big issue. Next. Next, yeah. So what we should think actually is that developing countries compared with developed countries have lower capacity, and therefore maybe they would need more stringent measures. Next. So for instance, the lack of response capacity, now we're starting just the tip of the iceberg in Ecuador, where the system was totally collapsed, and the contagious rate was really high, and particularly in Guayaquil. Next. Hospital, they couldn't treat all the cases. People, they were literally dying in the queues in the waiting halls, and dead bodies that were inside the houses and many times disposed in the streets. Or you have the approach of El Salvador, which is actually is predicting a scenario of high mortality, and they are literally, the public policy is literally digging tombs in the countryside. Next. So the developing countries, because of this health, the capacity of the health system, have a higher chance of mortality risk than developed countries. Next. Yeah, so now I'm going to focus on the risk of waste pickers. Next. So, next slide, please. So I think the key of the high risk of waste picker is by this paper. So that paper is in the New England Journal, and it's famous because it's the first paper to test the how long is the virus active in different surfaces. So the aerosol, so when someone coughs in an enclosed environment, it will last 3 hours. In copper, that is an antibacterial material, it lasts 4 hours. And in commonly recycled materials such as cardboard, it would last 1 day, steel 2 days, and in plastic 3 days. So in these last 3 products, you have the main problem of waste pickers exposure. Basically, in the process of sorting materials, waste pickers get exposed to materials with basically that have active COVID-2, which is the virus that later produced the COVID-19 disease. Next. So compared with a regular inhabitant in a developing country, the waste pickers have this higher exposure because of garbage handling. Next. I would distinguish between two types of waste pickers. So garbage and recycling sorting at the source, and garbage and recycling sorting at landfills. I think that they have very different probability of being exposed to COVID-2. Next. So, for instance, if we think about a waste picker collecting at the source, the probability of that waste picker to being exposed to COVID-19 is basically the probability of how many houses he is collecting from, because in many cases they have to open bags. In regular conditions, they would touch products that have an active COVID-2 virus. They would be exposed. Next. But for instance, if we compare, so in the second case, that probability increase a large amount. So in this case, the probability would be the probability of a household to get the infection plus the number of households, but as well one garbage truck would collect from different neighborhoods, and to a landfill it's arrived many trucks per day. So essentially, waste pickers collecting in landfills, they are exposed to a very large they have a very large probability of getting COVID-19. Next. Next. Yeah, so basically this is showing the equation, but there is another layer of exposition. So the population at risk, we all know that is over 65 and people with pre-existing conditions. So for the general population, the risk of having a severe disease is moderate, but for people over 65, it's very high. Well, as you can see, so the group of so from 65 to above is about 30% of people in the hospital. They belong to this age group, but as well around 20% of people that need to go to hospital, they are above 50. And that is very relevant because in a study of Sonia, 32% of the population of waste pickers in Brazil is above 50 years old. So it's a very large population at risk. Next. So in developing countries, there are people that are more exposed, and waste pickers, they are more exposed than a regular inhabitant to mortality risk because of garbage handling and because of their age composition. Next. And so now what can be done? So we're going to review some policies, so potential policies at the government, community, and individual level. Next. So without measures. Next. Basically, yep, I'm waiting for it. Next. So that would be the light blue scenario. Next. And the probability of infection of a waste picker is basically the probability of each person in the household to be contaminated, that then is transferred to waste, and then is transferred to a waste picker. Next. So it's really a funnel of COVID-19 with no protection measure. Next. And it only requires one line of contamination for the waste picker to be contaminated. Next. So basically, quarantine or confinement. Next. What it does is basically next. Isolate. So in this case, it would be the red scenario. Next. And so basically what it does is it cuts the contact of, it reduces the probability of a household to get contaminated, and that trickles down to a lower probability of the waste picker to get COVID-19. Next. So in another scenario that I imagine of cleaning and sorting, so to clarify this policy is basically what I am doing here is before putting my waste, basically I separate everything that is recycling and I wash with soap that garbage, that recycling material, so when it comes someone to collect it, it is not exposed. So if people would do that systematically, that would be an effective way of not, even if a household is contaminated with COVID-19, not to expose the waste picker, but there is very little compliance and you need a very conscious community. Next. So another scenario is either is basically providing personal protective equipment. Next. So in this case, the possibility of a waste picker to get COVID from the funnel, it doesn't change, just the protective measure is at the end by the waste picker reducing the probability of getting contaminated from contaminated recycling materials. Next. And finally, a scenario of confinement and a social salary. Next. So in this case, it would be isolated. So waste picker would take the same confinement than the regular population, and that could be even more effective, or a little bit softer measure could be just getting in confinement waste pickers that are in the segment of the risk population, so those over 50. Next. But for that, you will need a cash grant that could come from international funding. I think that for international agencies, it's not much money, from government, municipalities, and communities. Next. And to conclude, so next. Yeah, so COVID-19 will soon be a major health and social issue in developing countries where there is little social and health infrastructure. Waste pickers are particularly vulnerable population because of handling recycling materials and their age composition. A strong central and local government response for containment is key to reduce the COVID-19 risk of waste pickers, particularly in early stages. Household sorting and cleaning may reduce COVID-19 risk for waste pickers. Next. Personal protective equipment is necessary, but I think is likely not to be available. And house confinement of waste pickers in this critical period is the most effective strategy, in my opinion. But for this, we need an income source that guarantees the livelihood of waste pickers. Next. Thank you.
Thank you, Pablo. That was a wonderful presentation and very descriptive. We definitely have several questions for you, but we will get that in Q&A session. Samuel, if we can get you on board, like if you could unmute yourself. And if you could brief us what is happening in waste cooperative that you are a part of. For instance, like Pablo did mention that there are the virus is detectable on different type of waste streams on different days or on different time period. So what sort of changes have you guys made within your work? Or as Sonia mentioned, that the government should be providing the resources to you guys. So could you just brief us the status quo of your current situation and activities? Samuel, are you there? If you could unmute. Nina, could you check if Samuel is still in the... Oh, okay, so we will wait for Samuel, I guess. Anna, you could just message me if he's still there. Until then, I think we can take Zoe. Yeah? Yes, Nina?
Samuel is online and his audio should be working. So, but we can go ahead to Zoe and then come back to Samuel later.
Samuel just sent a message saying he is here.
Okay.
We can't hear you, Samuel. Can you maybe, are you muted?
Maybe I can... Yeah, Samuel, could you unmute yourself? Or say something so we could know that you were audible.
Don't you have the feature to unmute everyone?
Maybe yeah, Nina, could you do that? Could you see if...
Maybe he's having a hard time finding mute button.
I can't unmute Samuel because he muted himself, or if his audio is not connected. Oh no, now it should work, Samuel? No. It shows me that Samuel's audio is working and it's on.
Samuel, maybe you can try relogging in and we can jump over to Zoe till then and we will get back to you if that's fine. You can reply me in the chat meanwhile. Nina, could you share Zoe's presentation while I'll check out with Samuel maybe on our personal chat? Yeah? Zoe, if you could present here. Yeah. Thank you.
Wait, I'm opening the screen.
Thank you. So while my slides are opening, I'll just say hello to everyone again. Hopefully we'll be able to hear Samuel by the time I'm done. I'm going to give a much shorter presentation, just with a bit of an update of where we're at in WasteAid with the current pandemic situation, and hopefully giving you some pointers to some resources that you might find helpful or useful. So first of all, I think that thanks to Sonia and Pablo for raising and explaining some really valuable and important considerations for waste pickers and society at large, both now and after the pandemic has passed. I think from our perspective, it's almost I feel that maybe the plastic recycling and circular economy topics have been much more appealing to people, fair enough, and that waste collection has always been the kind of poor cousin. It doesn't really appeal to design students or very I don't know, blue sky thinkers. And we can sometimes forget that they are indeed frontline, key workers whose purpose there is really to, for public sanitation and to stop us all getting ill. And it's only at times like this that we really, the opportunity comes up to raise awareness about that, because I think that if you live in a country where your waste gets collected every week, it's very easy to take it for granted. And so this is a good opportunity in terms of communications about, the waste sector. I think this is a good opportunity to get people's attention and help them really value, the very important public sanitation work that waste collectors do. So if you could get me the next slide, please, that would be great. While that's just coming up, I'll just, oh, here we are, I guess there already, super. So what are we now, sort of 2 or 3 weeks into our change of operations really. Our first week we focused on getting the right guidance to our partners, and once we created that we just shared it online, in very much the same way as WIEGO and other organisations working in this space. So we produced a few posters which we sent to our partners in kind of plain English, but hoping that they will then, the idea being that our partners would then translate that information into the local languages, because obviously putting posters up covered in writing isn't going to be appropriate, especially for a lot of the waste picker community who are illiterate or who don't speak English or don't speak English as a first language. So we put those together with help from a couple of people that I've met through ISWA congresses, actually, both British people, Anne Woolridge and Tony Gladding, and they are kind of UK waste safety specialists. So I was really, we were really grateful to have their support in developing our guidance and making sure that we were giving the best advice that we could. And then we also sense checked it with WasteAid partners in Sub-Saharan Africa and with our colleagues at the Barefoot College in North India, in Rajasthan. Now, one thing that I would say, and I think in relation to a couple of questions that have popped up as well during Pablo's presentation, I think that there's still a lot of unknowns with regard to this virus, and so whenever you put guidance out, it's always, it's this situation where you can either research something, really thoroughly, and then at the end make sure, you can be confident that you're putting out absolutely the correct advice, but we don't really have time for that right now. So I think for everybody, and I'm sure the other panelists would probably agree that it's a balance between getting good advice and timely advice out there to people, because we can't really sit on our hands and wait for better data in a couple of months' time. It'll just be too late. So that's what we've done. We've done the best that we can for now, and we might be, reviewing and updating those documents as time goes on. I think one area in particular is face masks. So in the UK, up until now, the UK and the World Health Organization have also said not to use face masks because it can make you more complacent and you're more likely to touch your face, or the face mask might not actually be totally clean when you put it on, so you could be inadvertently giving the virus to yourself by putting on a dirty mask. So our early guidance didn't include advice for people to make and or wear face masks. However, I think as time goes on, my personal feeling is that actually I think because it stopped passing coronavirus to other people, I can see that actually the face masks are going to, I think it's likely that they're going to become more commonplace in terms of the guidance that's out there for people. So that's just one interesting area to note. There's concerns and considerations both ways. So there's no perfect answer, unfortunately. So just finally then, our other resources that we brought out, how to make a tippy tap. So a lot of places don't have running water, so a tippy tap was not invented by WasteAid. You can go on the tippy tap website and get all their information. It's a simple hands-free way to tip water onto your hands once you've washed them with soap. And then we also produced the how to make soap using waste oil, how to make hand sanitizers, and also composting at home, to try to encourage people to reduce the amount of waste that they're putting out for waste pickers or waste collectors in the first place. Can we have the next slide, please? So a lot of the advice kind of ties back to basic good waste management practice, to be honest. But these are the aims of our communications that we've been working on over the last couple of weeks then. So to ensure that people understand the risks and how they can manage them. And I would say that, life is a risky business anyway. It always is a risky business, and you can never eliminate all of the risk from your life. So, it's always something that we just need to manage and try to minimize and mitigate. Ensuring people present their waste in the best way to reduce the spread of disease. So that would include home composting, as I mentioned, and also holding onto your waste for 72 hours before presenting it for collection, or even taking it to the dump site. So we've decided to include that because of this, the residents, the amount of time that the virus can stay alive on a surface. Whether that's highly contagious at that point or not, I think is probably less important than just, it's a nice simple piece of advice for people to just hold on to your rubbish for 3 days before putting it out. Then we're also trying to work with municipalities to make sure that they do recognise the importance and the needs, specifically the needs of waste pickers, waste collectors and other informal workers. Lockdowns are fine if you're middle class and have a nice house to live in and you can stock up on food for a couple of weeks and that kind of thing, but for the majority of people in the world that is not possible, and so we really need to pay close attention to how public policy, well-meaning public policies, play out actually in reality for people in poverty. We've put out this advice for waste collectors so that they can understand and follow good practice, including, how to use your PPE, how to work with local residents and your municipality to make the best of the situation. And then finally, we've been continuing to raise awareness of the particular challenges faced and the ties between waste collection and public health. As I said at the beginning, it is often it's not been considered that relevant or sexy a topic until suddenly now. So I'm hoping that actually this is going to open people's eyes to the value of our industry. And finally, we need to attract donations. So the waste collector groups that we work with, they are seeing they've got this increased risk, as Sonia and Pablo have discussed, and so they have increased needs. So we've been working on trying to fundraise so that we can meet their needs. Could I have the next slide, please? Thank you. Is that coming? So I'm just going to talk a little bit about our changing needs. Is the next slide there, please? Thank you. Okay, this one, just very quickly, this is the sort of, the kind of guidance that we've been putting out. So we wanted to get it out, quite quickly. So we've been able to use some graphics from the WasteAid toolkit, which has been very helpful. So that's all on the website, wasteaid.org, if you want to access it. And then finally, I just thought it might be useful to talk a little bit about organisationally from our perspective. So, remote working we're absolutely used to, but like a lot of charities around the world right now, we are facing a quite significant loss of funding. So our corporate supporters and some of those businesses are struggling for different reasons. Our UK aid funding we've had to put on hold, and individual giving has also decreased a little bit, I would say, because people are more focused on their local healthcare needs, which is absolutely fair enough, but it's a reality that we're having to face. If we want to continue supporting our partners, we need to plug that gap. Meanwhile, our partners' costs are increasing, and we need to keep paying their salaries, obviously, and supporting them where we have been doing, where that has been the arrangement. We don't want to obviously drop that right now, so we need to keep going with that, make sure they've got adequate PPE, hand washing stations. For example, our partners in Kenya, they live in a settlement of 7,000 people, and the local community health volunteers came and installed one washing station for 7,000 people. So so we've got some pretty drastic needs that we're very acutely aware of, and we're trying to now fundraise for. So we've launched a new fundraising appeal called Waste Collectors Rock. Please have a look and help us share it on social media. We have some very exciting plans coming up that hopefully will encourage people to donate to the cause, and we will use those funds to support waste picker groups wherever they are. also, in the meantime, obviously there's lots of students who have suddenly found themselves locked out of their labs and away from their supervisors and so on. So we're stepping up with helping mentor students and other young professionals who are particularly struggling by being perhaps isolated at home in this time. So yeah, look out for things there. And finally, we're one good thing that's come out of it is that we are attracting more volunteers who are keen to help us with this awareness raising activity. So if people are, like, a lot of people have been furloughed from their work, for example, so they're at home and they can't work. So we're trying to provide opportunities for people to get involved and get behind the mission, because I think we are quite a small world, actually, those of us who work with waste pickers and waste collectors, or who seek to provide some representation for them. There's not that many of us, so it's really great to have opportunities like this. Thank you, ISWA YPG, for bringing us together. And that's the end of my slides. So happy to take questions after, but I'll hand back the microphone now. Thank you.
Thank you, Zoe. Thank you for being so detailed and getting all the questions, particularly for waste pickers and waste informal sector. Yes, Amelior, can we try again if you are audible now? If you just could respond randomly, maybe. I guess we are not able to hear him. That's quite a pity. So I think, Anna, we had to proceed with your presentation then, I guess, because we are not able to hear Samuel. So.
Has Samuel logged off, or is he still on?
He was replying, so I suggested him to re-log in, but yeah, he.
Hello?
Okay.
Hello, do you hear me?
Oh, yeah. Yes, we can hear you. Thank you for trying that again. Yeah.
Yeah,
so,
I just logged once again.
Yeah, thank you for the effort. Thank you so much.
Welcome. So the situation of French waste pickers are worse than every day. In France we don't have any inclusion to the right of work, to the right to access to materials. So that's why we found Amelior to protect ourselves from the attack of the police made by different local policies. We found Amelior to have a real representation and to organize markets, and organizing markets, make some money, and to collect, to buy a truck, etc. That's why we have now 5 employees. So every activities are stopping because we are under lockdown since 1 month. Since the first day of the lockdown, our members who are confined in a place without home or informal housing ask us to provide them help in food, for example. So that's what we are doing now since 1 month, and we receive the help of the Abbé Pierre Foundation, which is a foundation against bad housing, access to house. So they help us, and we can now continue to collect food. But we collect food for our members, people need, people who ask, but there is a lot of waste pickers in our region who do not have any association, who are just independent street pickers and second-hand sellers on informal markets. All the industry of metal are closed, so the people who pick up the metal cannot sell to industry, so the economy of informal economy is totally stopped and make a big danger for the people who just have resources from their informal work. So we don't have any answer from our municipalities or region, so we all doing everything by ourselves. We are used to. We have the moral support of the Global Alliance and WIEGO, who are thinking also that the situation is worse in different countries like South Africa, in South America, in Asia. Of course, the recognition of waste pickers, like we have a little, provide helps, inside helps, or like the Foundation Abbé Pierre can give us some money. So the situation is very difficult. The waste pickers are not, for the moment, pick up the waste because they are under lockdown. In the formal work of waste picking, who is a big part is private company, you know, some like Veolia, Suez, etc. There is not yet really apprehension of the risk. For example, our Ministry of Work said that the waste pickers, waste collectors, formal waste collectors do not need specific protection, which is of course a big lie. All the societies is begin to recognize that the poorest workers are the key of our actual solutions for provide food, to pick up the waste, etc. So the situation for the informal workers is just terrible. It means there is an alimentarian crisis for all these families, more or less 3,000 people. So the situation is not is not good at all. We are asking since 10 years now any inclusion, any recognition, but we don't have any from Paris or for others. Of course, to confine people in the informal economy do not preserve from a crisis like now we front. So we hope that after the lockdown will be stopped, we can ask new social rights, new professional rights, but you know, we are not sure that the people realize that we are contributors to the health, to the fight against pollution by our work. So there is maybe 20 million people who pick up the waste in the world, and I think the ones who are not included in any society, enterprise, co-op, or association are in a big danger now. The fact is, it's a world crisis in this century. There is maybe 500 million new poor in the world. There is not so much after the Second World War, for example, in the world. So we are now we are now very we fear that the situation going worse. So if you have any question, I can answer, but I have nothing more to say. That the situation is incredibly difficult, and we are collecting now foods to provide people. So we make charity, while in the same time, in years and years, we are not asking charity or any social recognition, but just workers recognition. So we have to adapt. Of course, we are very quick to adapt because we are used to face to adapt to all problematics. But this structural lockdown is not helping us. So we are trying with the police sector to ask the right for our members to go out to pick up the metals, but we don't have yet any answer. So that's it.
Mm-hmm. Samir, if you could comment a bit more upon, you guys are quick to adopt, so if this lockdown is taken off, so how you guys are communicating about the risk and the exposure, and how you think that your day-to-day activity is going to change or in what capacity you guys have that you would be able to change without the support of municipality, let's say?
Since the first day, we make traduction for the good gestures. We call it barriers gestures here. We make print and traduction and print and plastify this traduction, this paper to anyone, to any informal house. Because, for example, in our city there is maybe 1,000 people who live in a informal house. It means encampment, and there is 500 people, so it was very sanitarian situation was incredibly bad. We are asking now to open the water to any people who need in the informal place. It's beginning to be open, and we give also the WIEGO in French language, the WIEGO advertisements for cleaning hands, etc. But the waste pickers are not yet working, so they do not picking the waste for the moment. They are confined, they are locked down. So it's changed our way to work with our members. So we are connected by phone, and they ask if they need food, and we go to take food and give them food. But that's all what we are doing now. For health reason, we massify the collect of food, and we distribute from here, our center, or trucks of people come and they provide food to our neighbors, and that's it. It's very difficult to make health program without recognition of the existence of these people. People in France, waste pickers, sometimes they have no papers to be in France, so they are not at all included in any regional or national helps for food, etc. So the waste pickers case in particular.
Okay, Samir, we will get back to you because we have a couple of more questions. But before, I think, Anna, it would be nice if you could present, because we see that we are quite tight on time. Nina, could you share Anna's presentation?
Okay, then. So I just wanted to thank everyone for this opportunity for us to share our pressing concerns on the waste picker sector, and a special thanks to Samuel, who was able to share some of his insights of what's happening in France now. And I think part of what I'll be saying has already been presented or touched upon by several of the panelists here today, but I thought I would break down my presentation into two main points. And as you'll see, it's entitled Pathways to City Level Support, Relief, Coalition Building, and Recognition. Next slide, please. And as I said, the presentation was really thought out in two main points. The first one is speaking to the value of waste pickers' perceptions on their health risks. And the reason for doing this is to really honor and value the voices of the waste pickers that we work with here in Belo Horizonte and the metropolitan region of Belo Horizonte through the QUIDAR project. The QUIDAR project was an exploratory health risk mapping conducted as of 2017 through 2020, and we've been trying to work with the waste pickers in the sense of mapping their most pressing health risk concerns. And in 2019 and early 2020, before COVID hit, we were in the intervention phase of the Action Research Project. And what I'm going to try to do here is just map out some of the main concerns that we were hearing from them at that moment and how they're aligning with some of the main concerns for waste pickers during the COVID pandemic. And again, The reason for doing so is that many of the insights and findings helped inform the WIEGO guidelines for waste pickers on COVID, and taking into consideration that this is such shifting terrain on a daily or hourly basis. It also just comes to show how waste pickers, at least in Belo Horizonte and in the state of Minas Gerais, Brazil, really wanted to place workers' health issues on their agenda as a capacity building tool, but also a mobilizing tool. And they were also hoping that the Cuidar project could help them think of preventive measures. And this was all happening before COVID hit. So what we're seeing now is COVID exacerbating their concerns for health risks. But it's also an opportunity for us to rethink safety and security measures, not only during, but also post-pandemic, where we can try to start placing decent work conditions as front and center on our discussions. And the second point I'll be speaking to later are just some quick and easy support, not easy, but quick support measures for cities to adopt, taking into consideration the opportunity for rethinking what we mean when we say that collaborative urban governance can be a path towards resilient cities. Next slide, please. So again, here I've just highlighted four main findings from the Cuidar project that really speak to the main concerns we're hearing from the ground at the moment and in the past few weeks. The first one speaks to the fact that unorganized, improvised, or precarious infrastructure and workplace negatively impacts workers' health. And here I'm speaking to waste pickers working in sorting warehouses. And what we're seeing now is that this has encouraged many local cooperatives and leaders, along with their allies, supporting NGOs, technical experts within and outside government, start thinking strategically in the short term, but also medium and long term, what cities can do to provide waste pickers with more safety measures once isolation and lockdown measures are lifted. So there's been a lot of talk in terms of the logistics for going back, the importance of having adequate training, and even the importance of mobilizing the community in terms of campaigns and educational campaigns on recycling measures. The second point that I want to speak to that was raised during the Cuidar project is the lack of adequate and durable protective gear. And again, often throughout the project, we were finding waste picker leaders saying they just didn't have the financial resources to adequately and continuously provide their members with this gear. So what we're seeing play out now is a call for the public and private sector to come into play a bit more strongly and supply such gear. But what I think this also points to is the fact that there's an importance again for the continuous capacity building on workers' health and safety, and not just in ad hoc moments of crisis. The third point I want to emphasize, again, that came through very strongly during the Cuidar project and is also coming through in the alliance building processes that we're seeing in cities across Brazil, is the need to sensitize health professionals, government authorities, and the community is specifically on what waste pickers' work routine entails and the day-to-day risks they face. So again, here this is leading into some forward thinking on what are going to be the educational campaigns on proper waste segregation that can reduce waste picker risks. And here we also heard some other speakers, and Sonia also mentioned this, the increase of medical waste arriving. So this is something that's been on everyone's mind here for quite some time. And another key concern that was raised during the Cuidar project and now is linked up to what we're seeing play out in COVID is the fact that another concern is a lot of the age composition in the cooperatives that we work with are elderly workers. And Pablo mentioned this again, referring to one of Sonia's studies. So what we're seeing during the Cuidar project is that a lot of elderly waste pickers wanted to have more access to information specifically on their non-communicable diseases such as hypertension and diabetes specifically, and also to some gender-based vulnerabilities due to the care responsibilities that many of the women waste picker members face. So again, this is on their minds in this moment in terms of what's happening to the older workers who are no longer working, what's going to happen to these older workers when they do return to the waste picking cooperatives, what's going to be happening in terms of the emotional stress placed on women once they're home, and also on the women leaders in terms of dealing with all the demands coming from the livelihood losses at this stage. So the next slide, please. And again, these concerns aren't new for those of for those of us working in the waste sector. But it just shows again how COVID has exacerbated the vulnerabilities for many of the informal workers. And I just wanted to stress that I'm talking about a specific context of workers that are organized working in waste sorting warehouses, but we know very well that the realities and the vulnerabilities are much more intense for those working in the streets, for those that are unorganized, for those working in open dumps, etc. So what I'm trying to think here when I present some of the ideas behind what city responses can be is really framing this kind of discussion on three main points. And that's the idea or the question of how committed cities are to protect waste pickers' livelihoods or to protect the most vulnerable's livelihoods. How are cities committed to upholding the dignity and safety of waste pickers and informal workers across cities? And how committed are cities aiming towards decent work conditions while we're in this crisis and moving beyond it? And I'm going to present really three basic points here. And the first one speaks to immediate relief efforts. The second speaks to the recognition of workers' agency and knowledge, and that's why I chose to begin with some of the QUIDAR project findings to really raise the voices and concerns of the waste pickers in terms of their home health risks and safety. And the third one speaks to more longer-term actions in the sense of really strengthening and building coalitions across sectors and allies so that we can have channels of dialogue where we place front and center the voices of these workers. So next slide, please. The first response, again, speaks to many of the issues that others have raised, and there are responses that cities can take to mitigate health risks and some of the economic hardships that we're seeing play out. The first one is obviously implementing cash grants in an accessible manner. The second one is providing technical information and training for protective gear. And again, I'm going back to that idea that Zoe has also mentioned and others, that this is very fast-moving terrain where we're just learning on a day-to-day basis what's happening. So my understanding here is that technical information is central, but more so than that is the adequate training so waste pickers understand the risks that they are facing if they are considered essential service providers at this moment in certain municipalities. And again, the absolute need for the distribution of the protective gear that's deemed essential, and something that's very important.
In the audience, could you all please mute yourself? Like, Nina, could you please?
Okay. I'll try to continue. And the last point I wanted to make, and this is something that Samuel touched upon and is very important, and we've been hearing this a lot from our leaders, is how cities can guarantee food security. So we've been seeing a lot of campaigns from the civil society and the national waste picker movement's efforts with their allies to really provide and disseminate solidarity campaigns, but there's also an effort for cities to come in and play a role in guaranteeing food security, especially for those cooperatives and workers who are no longer working and can't provide for their own livelihoods. So this is something that we're also seeing play out very strongly here in our cities. The next slide, please. The next slide.
Nina.
Okay. And the second point that I want to make is that this is an opportunity also to recognize waste pickers' agency and expertise. And we know waste pickers have key knowledge to offer on the problems that directly affect them. And we've seen how workers in their waste picker cooperatives, with the very few resources that they do have, collectively and innovatively address the health risks that they're facing on a day-to-day basis. But in order to abide by the local authority measures that are being placed, they need government support. And so they can only abide by these measures if they do receive the adequate support based on the immediate relief efforts that many of us have pointed out today. And by recognizing waste pickers' agency, there's another step that cities need to be taking in the longer term, which is understanding that policies and decisions need to be made on the unique challenges faced by this worker sector and other informal workers. So your cities can start really committing to platforms or spaces of dialogue where they're discussing and deliberating together how they're going to tackle the challenges of waste pickers heading back to work together. And the next slide, please. The next slide. Okay, and as I'm wrapping up, I just also wanted to stress that this is an important moment for us to be thinking about strengthening dialogue and alliances with civil society actors, and this includes key research centers and universities, supporting NGOs, waste management experts both within and outside of government, and committed local authorities. And on a short-term basis, we know that we've seen some interesting innovations in the sense of trying to together disseminate clear, accessible, worker-friendly materials. But again, on a longer term, all these allies need to be thinking together strategically on how to rethink decent work standards and conditions as the lockdown and isolation measures are lifted. And that can only happen if the community and government are starting to truly recognize and visibilize the important work that's being done by waste pickers historically. And again, in order to do that, you need to center the voices of the workers and consult them on how to move forward in this pandemic and beyond. So lastly, I think what I'm just going to bring together to tie up my presentation is, if this isn't a moment for us to really rethink the roles and responsibilities of both the public and private sector to truly guarantee more decent and just working conditions as we face this pandemic together. And here's quite an ambitious question that I ask and present to all of us here today, but is it possible then to recenter the principles of trust, solidarity, and community engagement as we try to reframe the dynamics of these roles and responsibilities between the public and private sector in order to tackle the exclusionary and unjust urban city policies that we've been witnessing across the global south and truly exacerbated in this moment? And underpinning all of this is the idea that I'm trying to bring, that perhaps here we need to go back to the idea of collaborative urban governance, which really looks at the interdependence and interconnections of multiple urban systems and multiple actors. Because at the moment, we are truly acting in a proactive manner, trying to mitigate, the economic, health, social impacts of COVID. But can there be resilience mechanisms that we take forward to really work together in the sense of the future challenges we will be facing? And I think it is a moment for cities to be held accountable to the needs of the most marginalized and vulnerable at this moment. So thank you for your time, and open to questions and comments afterwards.
Thank you, Rana, for bringing all the concerns up. Of course, these questions and these concerns are not just limited to COVID situation or post or pre-situation. This should be happening before and should have progressed far more. Just to get early statements from all of you, because many in our group are actually making some guidelines and stuff. So there have been some concerns about what should be the status of the waste pickers at this moment, or what all of you personally advocate for to the municipalities. Should they be considered as essential service provider during the time of this pandemic, or they should be provided with relief packages and their status should be essential daily earners only? Because Pablo did mention that he advocates the quarantine and the lockdown. If I get it right, Pablo?
Yeah, so I think there is the main problem is that there is a tension. So there is a tension for making a livelihood. So a full lockdown with no social protection is unfeasible in itself, because you would end up actually with the situation that Samuel is describing. So people really struggling to make a living. But so that is one thing. So if you use a lockdown measure, you really need the cash grants that Sonia and Anna is talking about. So, but they need to be complementary measures. You cannot do a full lockdown. So I think what I have presented is like there are other things that you can do. But to me, the main issue is that this is really, really a serious illness. And there are a lot, I am currently based in Europe, and there is a lot of people dying because of this. And by looking at the numbers, it seems that the situation in developing countries is going to be much serious than here, and the waste speakers in itself, they are much more exposed. So it's really, really, really risky in this moment to collect material particularly from households, because you are essentially multiplying the probability of getting COVID-19. So therefore, I think the most effective measure is lockdown, but it needs to be complemented with cash grants. Otherwise, you're going to put people under pressure, under social pressure.
If I may chip in, yeah, I completely agree that this is an unprecedented crisis. The thing is, it is a crisis in which the working poor, they are confronted with this dilemma to die from hunger or to die from coronavirus. And it is not an easy decision to recommend, yes, you know, you go to work because you need to, you know, to put food on your stomach, and it's not also easy to recommend a complete lockdown. So we are faced with a real dilemma. I think what we have to understand, I agree that we need complementary measures. Here in Brazil, most of the waste experts networks that I belong to, we have advised for a lockdown of the cooperatives that we work with, the waste pickers that work with us, because we understood that this is such a serious crisis that we need to take a precautionary kind of approach to prevent them to be exposed to even greater risk. And we are struggling very strongly to implement cash grants. But this, you know, it's at least coming from a city that has more than 21 years of partnership between the waste pickers co-ops with the city, and in which we have some systems in place, it's a little bit easy. It's not easy at all, but it's a bit easier when you compare with a city in which there are no measures, social protection measure to support the waste pickers, the informal waste pickers, to go on lockdown. And we have other things that we need to take into consideration. You know, in some cities, in some countries, waste pickers actually perform the only household collection that there is. So it's a really complex question. The thing that I've been asking myself is, how can we take the opportunity to push forward a coalition in which we start to exploring in depth and also ensuring the resources for, you know, the kind of measures that can allow us to have waste pickers performing whatever job they do, you know, be it collection of household waste or collection of recyclables, what a reasonable set of measures that the municipalities need to put in place, you know, for the waste pickers. How can waste pickers organizations abide? What kind of changes would they have to go through to abide to these measures? At this moment, we cannot do that because we are trying to mitigate, you know, a crisis. So for me, it is very much a call for asking waste pickers, asking governments to support waste pickers with cash grants, with food baskets, so that we can address food security, because it's really hard to ensure that they will be protected with safety equipment at this right moment. But this is a personal, okay? It's not even a, we still struggling, you know, institutionally how to frame this whole discussion about essential workers, because at the end of the day, it's how our former WIEGO international coordinator puts it. They are faced, you know, the dilemma of dying from hunger or dying from coronavirus, and it's not a, you know, an easy answer.
Mm-hmm. Anna, do you want to comment any further?
I'm sorry, I was muted. I think Sonia and Pablo have covered the complexity of the issue at hand at the moment, and I think I'll just refer to one of our cooperative leaders here who mentioned how risky this moment is, and that they're struggling with being in lockdown and not operating, but they understand that their health and their members' health has to come in the first place, but they do need the support from their allies and government. So again, it's finding the balance and complementarity that we've been speaking to, because it really is an enormous public health crisis that's going to be leading into catastrophic economic crises down the road for many of our developing countries. So I think we're all testing the waters and trying to understand what happens. And for those that are considered, the waste pickers that are considered essential providers in some of their cities, it's absolutely fundamental to provide them with the gear and training as they're doing their work and understanding the risks at hand in this specific moment, much more so than before. So again, I think we're treading complicated waters here and trying to understand how the waste pickers can protect themselves, but also protect their livelihoods and the livelihoods of their families.
Mm-hmm. Okay, I think that could be just the last question. So Anna, you did mention about the alliance and partner, and in Sonia's presentation, she did mention about industries having a responsibility. So I just wanted to have like your opinion, a bit more comment or explanation about what sort of responsibility or role do you expect in your advocacy roles for the waste pickers and the informal sector from the industries and the producers and manufacturers, let's say?
You can begin, Anna.
Sure. I think what I'm going to pick up on more is the idea of the alliances that we're seeing play out here with civil society actors and with technical experts both within and outside of government. And again, this speaks to the reality of Belo Horizonte, which has historically had a participatory process and inclusive solid waste management system with committed actors in multiple levels of government, but also at the city level. So what we're trying to see happen now is that all of these committed actors are trying to think forward in terms of the strategies that can be implemented for fairer rules as we go down the next few weeks, because we know that the value chain has been very affected in the recycling sector. We're also trying to think of logistics-wise how these waste pickers will go back to their cooperatives and trying to think through with these partners. So in that sense, it speaks to what I had mentioned before. It's strengthening these alliances within and outside of government so that we can pressure government and work together with them to think through these logistics and safety measures once they go back to the cooperatives. And then there's the role of the industries that I'll pass on to Sonia if she can answer that more clearly.
Hi. Well, this is a very important question because, as I had raised, this is a moment that more than ever we need an all effort in terms of coordinated actions between industry, governments, workers, organizations, and citizens. And giving an example of how the industry can contribute, I'll divide it into kind of main actions. I think there is one thing. We all agree that this is now a time where we have to focus on kind of immediate responses, you know. And in that sense, industries, some of the industries who belong to coalitions in Brazil that support waste pickers, they are backing the national waste picker movement in a national campaign for solidarity. NGOs like WIEGO and ISWA and Observatory for the Inclusive Recycling and many other organizations, together with waste pickers, co-ops, and their national movement. And some partners coming from the industry, we launched this campaign to fundraise for cash grants for hygienic kits and for food baskets. So one thing is to join in terms of immediate relief responses. And the second kind of contribution from the industry is it's more transformative, I think, and it's for the post-COVID-19 phase. We really need to redesign the recycling chain. Waste pickers are at the bottom of the pyramid, of the recycling chain pyramid. They face the highest risk, but they earn the lowest pay. And one of the contributions that industry could do is to commit to inclusive EPR systems, to inclusive extended producer responsibility systems. And I think this is a more transformative contribution from the industry.
Pablo, do you want to comment on that? With that, we will be closing then.
Yeah, just to comment, like, there are several levels of potentially that you can involve to get support, and I think that one size fits all type of policy is not what I try to suggest in my presentation, and is not feasible. For instance, local governments themselves, they have different approaches to waste pickers. In some areas they are repressed. In other ones, they have a laissez-faire policy, and in other ones, they are supported. Probably you can get much more even cash transfer from local governments. They are more likely in places that they are currently supported than in the other places. And probably you have to go for more soft measures in places where you have laissez-faire, and probably in repressive measures when waste pickers gonna be try to put out of the street, you need to include some social policies. So I think what I try to present is basically there is an array of potential measures that you can take that need to be based on context, on what is feasible and reasonable in one particular context. Yeah, so basically that. And the main objective, it should be about which policy is feasible, and at the same time it reduces the risk of getting COVID. Yeah.
Thank you, all of you, for sparing your time. We will definitely contact you for further information, perhaps because there are some technical questions, and also WIEGO is doing such great work. As well, I have read myself Pablo's papers, and they were like quite awesome. So we might request you for the access and for maybe the dismantling of the information, if that would be all right with all of you.
Sure.
Yes, absolutely.
Thank you, and perhaps we can see you on our future sessions, because you guys have raised several important topics, I would say, not just a point. So thank you for sparing your time. Thank you so much, and I hope it was a really nice session. And in the audience, we hope to see you again. Take care and goodbye. Yeah, thank you.
Yeah.